Big announcements today on the issue we're all focused on, our health, our well-being, fighting back COVID, building a healthier future. We've learned a lot from the COVID crisis. It's been a tough, painful time, but we've also learned a lot about what we have to do differently, what we have to do to prepare for the future. And if one thing this pandemic has taught us, it is the profound value of public health, of a strategy that reaches to the grassroots, that gives people access to health care in ways we have just not done enough of in the past as a city or a nation. This is a moment to do things very, very differently, and there is no place better to innovate than New York City. There's no place better to create a new paradigm than New York City. There's no place that has more experience dealing with this crisis, but also innovating approaches to engaging people, reaching them, protecting them. No place has done more than New York City. My goal is to make New York City the public health capital of the world. And I don't say that lightly, and I don't just say that because we're New Yorkers and we're proud and we believe we're special. We are special, and we went through hell with this pandemic. We were the epicenter for a long time in this nation. We learned the lessons to know how to fight back in the future. But we've also done amazing things historically in New York City when it comes to public health. A lot of the greatest approaches, a lot of the greatest leadership in the whole country's history on public health came from New York City. So we are ready to do new and different things. Two major new pieces today, two major new thrusts that are going to change the future of New York City, make us healthier, help make the whole world healthier. First, our public health core, taking the incredible lessons we've learned from the test and trace core, making them permanent, having a permanent ability to reach people at the grassroots, encourage health, support people, educate people, get them to the health care they need. And the Pandemic Response Institute. The Pandemic Response Institute takes everything we've learned, helps us make sure there will never be the next pandemic, creating the solutions, creating the approaches to stop pandemics from ever happening to begin with, or if God forbid there is one, being able to deal with them in new and better ways. Okay, the public health core first. Look, we understood after the first weeks of the COVID crisis that so much of what we were dealing with was a question of public education, reaching people, answering their concerns and questions, getting them to the help they needed. And that only works when you're connecting directly with the people at the grassroots, and ideally with community members leading the way, with people from that same community talking to their neighbors. That takes something that requires a permanent feature, something that allows us to reach people constantly, not just when a crisis has already begun. Look, we had to create the test and trace core out of thin air, out of scratch. We had to create something. It's become the biggest and most effective in the country. I want to thank everyone at Health and Hospitals that led the way on this effort, working with the Department of Health. Thousands of lives saved by the test and trace core. And amazingly, test and trace just hit its millionth, 1 million tracing contacts. Well, we learned a lot from test and trace core. We learned a lot from our Vaccine for All core, the amazing work the vaccinators did. Again, that was put together from scratch. Look at what they've done. You're going to see the vaccination numbers today. They're outstanding. They're unbelievable. We're going to take the people who worked on test and trace, the people who worked on Vaccine for All. We're going to create a new permanent New York City public health core. This is truly revolutionary, but it's something you're going to be seeing more and more of. And love this logo. You'll be seeing people wearing these shirts who are part of this public health core, going out in the neighborhoods, going door to door, going to community meetings, educating people, preparing them for the world after COVID, because we need to do everything we can to get out of the COVID era. It's coming soon. We have the chance to get out of the COVID era, but then we have a lot of other public health challenges that we need to address. So, public health core, particularly in connection with the amazing work we've done with NYC Care. Again, thanks to everyone at Health and Hospitals. NYC Care, guaranteed health care for all New Yorkers. This is something there's still a lot more ability to reach people with, to get people health insurance who don't have it, to get people connected to primary care medicine who don't have it. We guaranteed all New Yorkers health care. The public health core is going to be leading the way to get people connected who haven't been before, and that's going to make us resilient. One of the things we learned in this crisis is folks who had not had access to health care were very vulnerable. People who went years or decades without the health care they deserved were often the folks who were the victims of COVID the most. Getting people health care, getting it to them regularly, making sure everyone has it when they need it. That's how you turn things around. We're going to be employing thousands of New Yorkers in this effort from the communities most affected by the challenges of COVID. And it's going to say something very clearly, that in New York City, we believe healthcare is a human right. It's as simple as that. Healthcare is a human right, but we're not just talking about it, we're doing it. Guaranteed healthcare for all, a public health core, leading the way with the ability to reach people like never before.